Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Neni Rahayu. I am a midwifery student from Hasanuddin University. Thank you for this opportunity. I will do presentation this research, the incidence of anemia in pregnancy at Makassar Health Center in 2019 until 2021. Okay, I will go to introduction. Anemia is a global health problem that affects more than 1.62 billion people in the world, with a prevalence of around 9% in developed countries and 43% in developing countries. Anemia is a condition in which the number of red blood cells is lower than the normal number due to a lack of iron consumption. This happens because the red blood cells don't contain enough hemoglobin. Globally, the prevalence of anemia in pregnant women in the world is 38.2%, with the highest prevalence in the Southeast Asia region of 48.7%. In Indonesia, the prevalence of iron deficiency anemia in pregnant women in 2018 was 48.9%. This number increased by 11.8% compared to 2013. The high prevalence of iron deficiency anemia during pregnancy in developing countries is still a major problem causing maternal and perinatal morbidity and mortality. Pregnant women can be said to be anemic if the hemoglobin level is under 11. Deficiency anemia in pregnant women is an increased risk of preeclampsia, postpartum bleeding, infection, and lack of hospitalization. In fetus and infant, it can cause stunted fetal growth, low birth weight, stunted cognitive development, socio-emotional, adaptive, and motor function. Anemia in pregnancy cannot be separated from the physiological change that occur during pregnancy, the age of the fetus, and the condition of the previous pregnant woman. During pregnancy, the body will experience significant change, such as the amount of blood in the body increase by about 20 until 30%, so it requires an increase in the need for iron and vitamin to increase hemoglobin levels. During pregnancy, the body needs up to 30% more blood than before pregnancy. Okay, this is my method. Descriptive analysis that describes the incidence of anemia in pregnant women at the Makassar Health Center in January 2019 until October 2021. The secondary data sample used was a pregnant woman who met the inclusion criteria. The data collected is secondary data obtained from the registration book and the cohort of pregnant women with the variable number of anemia in pregnant women, age, education, occupation, and parity. And this is my result and discussion. So, you can see the first table about distribution of anemia frequency in pregnant women in 2019 until 2021. So you can see this table about gestational age mother is trimester 1, 2, and 3 in 2019 until 2021. And the second table about frequency distribution of maternal characteristic. So you can see in this table about mother age, mother education, mother's job, and parity. This is the conclusion. Anemia in pregnancy is very common because the need for iron during pregnancy increases compared to women who are not pregnant. The results showed that mothers with anemia at the Makassar Health Center were mostly found in the trimester 3, aged 20 until 35 years, secondary education, private employees, and primigravida mothers. The author suggests that midwife and health workers routinely provide counseling to pregnant women and the public about the risks and dangers in pregnancy, routinely check hemoglobin in pregnancy, and provide supplementation of blood-added tablets to pregnant women with anemia. Okay, for the last, this is my reference. You can see in this slide I have 8 references. Okay, this is my presentation. Thank you for watching and thank you for listening, and God bless you.